Hello, everyone, and welcome back to another insightful episode of MedSynapse podcast series, where we bring you the insightful conversations with leading experts in the medical field. Today, we are delving into an often overlooked yet crucial aspect of breast cancer care, which is comprehensive rehabilitation post treatment. We will be discussing the physical, emotional, and holistic recovery journey that impacts millions of women around the globe. And to shed light on this topic, we have an extraordinary guest with us, Dr. Neerja Gupta. Dr. Neerja is a distinguished breast cancer surgical oncologist and oncoplastic surgeon with over 25 years of experience and is renowned for her skill in blending cancer treatment with reconstructive techniques that prioritize both healing and quality of life. Doctor, it is an honor to have you with us again.
Thank you. Thank you so much for having me here.
So, doctor, to start with, let's start with an overarching view. From your extensive experience, what are the most common physical and emotional challenges that breast cancer survivors face after completing their treatment?
Right. So, this is a very crucial topic, although it's not discussed so exhaustively. But rehabilitation after the treatment, even at the time of diagnosis, starts from the time of diagnosis, and you have to handhold the patient, be in proper communication with the patient, create an atmosphere so the patient doesn't have a social stigma, right? She has got cancer, and then she will never be back to her normal life. So rehabilitation entirely means bringing the patient, integrating her and reintegrating her into the society or the community, so that she is back into her normal life and she becomes not only settled down emotionally, physically, but socially as well. After the treatment, what happens is, a lot of times after surgery, patient will face physical nuances like lymphedema, because the lymph nodes need to be removed, they have to be radiated, chemotherapy is affecting, so the chances of having swelling in the arm increases. So avoiding these, first of all, the patient has to understand the implications of each and every treatment, and prevention is always better than cure, as we say. So if she knows what might happen to her, then she may be well informing you in time. So that is the way you can avoid lymphedema, and if it does occur, you can always curb that lymphedema in stage 1 before it progresses to the second or third stage. Then comes your body image, which is very, very important. And women in our society, they don't talk about it. Rehabilitation, physical rehabilitation, and the breast, reconstruction or building a new shape of the breast and giving her a good body image is as important as anything. It forms a part of the treatment. So the patient needs to be offered all those possibilities. If she's eligible, conserve the breast, the planning happens before the start of the treatment at the time of diagnosis. Otherwise, if she has to undertake mastectomy, that means the removal of the breast, then also you can always refer or take care of how you can reconstruct her breast back. These are important. And about emotional, yes, we have lots of emotional turmoils at the time of diagnosis, not accepting the treatment, not communicating with the family. She needs to be having a constant support from her physician, from her family members, from the society, so that you can bring her back into the society, into the health as it was before this diagnosis. So that is all about rehabilitation. Rehabilitation actually came from the understanding of the word good news. It has to be a very good news for her. She has to accept and realize that she will be back to her normal health once everything is done.
Yes, actually, and that is so enlightening to hear also your insights. And I feel that addressing both physical and emotional healing is so vital for holistic recovery. Now, coming to the next question. So, could you share some evidence-based physical therapy practices that have shown the most effectiveness in managing lymphedema, pain, and limited mobility?
Yes, absolutely. So, physical treatment, if I talk about lymphedema, The physiotherapy, if it happens, what the oncophysiotherapist is given the task of, you know, restoring her shoulder movement, every movement, so that she can perform her daily activities, and there is no hindrance to that. So, start the physiotherapy from day one and encouraging her to do the arm movement and everything without taking too much of stress. So, that has to be graded. You can't expect her to be lifting weights from the first day. But yes, over a period of time, once she settles down, she can do a bit of yoga, aerobics, but we always ask her to avoid any kind of heavy weights to be lifted or any, tight armlets to be placed on the arm or maybe injections. So there are certain precautions. But yes, physiotherapy from day one is one thing that we follow, and it definitely helps the patient. Then even yoga in certain studies has added to it is a supplement. I'm not talking about a substitute. You can never substitute physiotherapy, but it can always supplement the treatment of the patient when the lymphedema starts. In that condition, yoga has found to be very, very helpful, not only for the mental health, but also for the physical activity. So, physically, yes, these are the methods. And then reconstruction, we all know, is something which is an entirely different subject. And the team of physicians, starting from the oncologist, the entire onus or the responsibility goes to the oncologist. So the availability of a physician, whosoever, whether it's a physiotherapist or whether it's a counselor or whether it's a psychologist, in the team is important to talk to the patient whenever the patient is needing you. So these are very important things, and the team has to work in building the patient back to her normal health.
Yes, I think that is so rightly mentioned, and that these are some incredible practical suggestions for you. And I think the integration of both physical and physical exercises and mindfulness actually creates a comprehensive recovery approach when coming to breast cancer surgery. Now, also, let's touch upon an aspect that resonates deeply with many, which is like body image and sexual health. So these are some very delicate subjects, but essential for a survivor's quality of life. So how do you think healthcare providers can approach these conversations with empathy and cultural sensitivity? So this, the marital harmony and recovery from a treatment and, building the rebuilding the marital relationship is a very, very important component, because the atmosphere in which she has to sustain her the rest of her life has to be very, very healthy and positive. If the family, a husband in the family doesn't understand the importance of her mental health and her being, strong in terms of her own body image, until she feels she is looking beautiful, if she doesn't see that in the eyes of her husband, that is immaterial. So if she finds that change in the way she is being looked upon by the family, by the spouse, by the social, whatever groups, wherever she goes. So that definitely has an impact. So a lot of things, they're not spoken, but they are definitely taken. So the family, everybody in the society, it is a social cause. It is a social task. Rehabilitation is not something which is assigned to a particular person. It is not assigned to the patient. She is not supposed to be, gathering her efforts to do not the only one. Not only the patient, not only the physician, not only the psychologist, not only the emotional rehabilitating person, not only the physiotherapist, the geneticist, the oncofertility specialist. It's a team. So everybody has to work on bringing her back to the normal. And this is a social task. And it is the most difficult part. Even difficult than the treatment, because the treatment will finish in a year or and a half. But what happens later, what the life she's going to live later, entirely depends upon how she has been rehabilitated back into her own house, back into the society. And then the follow-up care. Even the long-term care, this is important. It's part of the rehabilitation. So the follow-up care again is important.
There are certain countries where they have raised these societies or groups who take care of the follow up, and they remain in constant touch with the oncologist, reporting them each and everything and referring the patient to the needful physician. So, rehabilitation is a constant process, it is never ending, right? And it is difficult and it needs the support of the team.
Yes, absolutely. That is so rightly mentioned. And actually, thank you so much for emphasizing the importance of tailored and culturally aware communications. That is so very important, rightly mentioned. So now moving on, rehabilitation needs can vary very significantly. So how do you personalize these rehabilitation plans, especially considering factors like age, cancer stage, and even comorbidities?
So, yes, you every care is personalized. You cannot generalize a treatment to a patient. No patient is same. Patient coming from a Muslim family, has a different concern. Patient coming from a young patient recently married, God forbid, but she has a different concern. A patient who has got two kids to raise has a different concern. So every patient is different. So that is why the team. That's not very. It's. I would say it is. It won't be appropriate if I say myself as an oncologist can do everything and bring back the patient to normal, to get reintegrated into the system. Where it's not right. It is a team that works. Every single moment when she comes to the hospital to follow up, when she leaves the hospital, whatever she's been talked about, you can talk about the front desk person, the reception person, how they greet her, and then even the people who are working in the oncology team, how they greet her, how they treat her. Every single person, apart from the physician, the list of physicians I said, oncologist, the psychologist, the physiotherapist, emotional rehabilitation person, all these people, every single person is contributing. So that is why I'm saying whenever the patient comes and speaks to me, something which is not expected, so I take it seriously. It has to be a prime concern. You cannot weigh the emotional imbalances. You cannot weigh the emotional damages. Until date, the law doesn't have anything to, subject somebody and weigh how much damage the person has caused to the other person. We don't have laws, such laws. Nobody has, right? And I don't think anybody would ever think about it. But the fact is, lots and lots of emotional damages and mental hazards are because of whatever happens to you every day around. So everything contributes, right? Whether you create or disseminate positivity or you say something which really bothers her, everything matters because she's not going to recoil back immediately from that. Nobody can recoil back so immediately. It's human. So every single statement, every single word that you speak out in general, to any patient is important. That is why you have to be proactive in seeing how your patient. So when the patient enters the OPD room, no, when I look at the patient, it gives me 5 and 10 seconds, and I know how she's doing. So if I see her, especially if you are seeing her after say 3 months or 6 months, so the moment she steps in, you can look at her and you know there is something wrong or that something is absolutely fine. So these things definitely matter. You have to be observant and you have to take whatever they say, it has to be, regarded and actioned upon. Very important.
Yes, absolutely. And I think earlier, as you mentioned, that multidisciplinary approach is also very important when dealing with patients' emotional needs as well, I feel.
Lifestyle factors. First of all, it's important to create, something around you so that you are not disturbed by anybody. That is very important. Although it's not easy, but yes, lifestyle changes, physical activity, because the more sedentary you keep thinking, then definitely you are spoiling your own health. The most detrimental factor. So physical activity is important. Do whatever you like, but if you want to go to the gym, You can go to the gym, but we recently had a few celebrities doing it. Now can't doing it. So I don't know how much weight she was lifting. I am not going to comment on what is right or wrong, but I'm saying what you feel is good and which is within the boundaries is acceptable can be done. So do something that makes yourself happy. Do something which keeps your body fit and fine, and eat something which keeps you healthy. So all the three will count. Emotional, emotions, body, everything is linked. Your mind, your body, your nutrition, everything is aligned. You disturb one, the other one will be disturbed. So it has to be in line, all the three.
Right, alignment is also very important between all of these. Now, finally, technology is making waves in healthcare. So, how do you see the role of telemedicine, virtual support groups, or even rehabilitation apps evolving in post-treatment care for breast cancer patients?
Yeah, so technology is evolving, and with that, we have a lot of hazards, Google hazards. We have people not understanding what is meant by, whatever they have free access to all the kinds of terms. And because they don't understand and keep Googling, that creates a lot of nuisance and anxiety. So, hazard is there, but yes, you can utilize the technology because you can create, not just interaction, communication, which is important. The way I'm talking to you right now, suppose I'm busy with my patients, I'm not able to come to your center for such an interview or podcast, then it becomes difficult. And so, technology is definitely, communication is getting easier and easier. Number one, that is important. You can communicate with your patients anytime. The way I'm talking to you can be there. And yes, the records and everything are important. This is something which is scientific, I would say, so that one clinician can understand what has happened to the patient in the past. That is important. And then, AI has got lots, AI is evolving, and AI will be helpful in guiding the patients because then we can have tools where patients can access or book their own appointment systems in a click. They can access their relevant medical information. Sometimes they lose it. The papers are lost. This is important for their journey. And then they can even, with AI, they can always have their inputs or their symptoms or something. Suppose the doctor is busy. Doctor is not able to talk to you. It's not possible to talk to the patient at the same time they call. It's very difficult. But then they can always put in their complaints or something in that particular box, and then the doctor can read it at the end of the day, and then they can revert back. So this is possible in the coming few years with your rigorous schedules, with your busy schedule. This is very well possible that the doctor can respond as early as possible whenever the patient has a problem.
Yes, I think it is so inspiring to hear how technology is opening new doors for patient engagement, the conversations, and making it much easier. So it is very good to hear. Now, as we wrap up today's session, Doctor, thank you so much for sharing your insights, and it has been invaluable for us, especially covering everything from physical recovery techniques to the emotional scaffolding needed for fulfilling post treatment life. So, thank you so much for sharing that with us.
Thank you. Thank you.
Thank you to our viewers for tuning in. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, remember the journey to recovery is multifaceted, and as healthcare providers, your empathy and knowledge can make a world of difference. Thank you so much.